The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome back to the Confidence Doc podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon in Houston, Texas, also known as the Confidence Doc. And today we have a first. We have Dr. Liz Malphrus. Oh my gosh, I did it. Dr. Liz Malphrus.
Yes, nice.
And she is a chief resident in plastic surgery at Penn. And she's going to talk to us a little bit about today what it's like to be on that end in the training process. So welcome to the show.
Thanks so much. I'm really excited to be here. I love the podcast. Excited to be on.
Thank you. So tell our listeners a little bit about what it is to be a chief resident and how you got into plastic surgery.
Totally. So being a chief resident, I'm in my last year of training. The training that we go through is 6 years. So it's like 4 years of medical school and then 6 years of training like in the hospital where you're working, but still learning like a ton, learning how to be a surgeon. And so I'm in my very last year of that. We have a really fantastic chief gear experience. Basically, you're at the top of the hierarchy of the residents, so you get to pick which cases you want to be in. You get kind of first choice of everything. And it's also really exciting. You know, it's time to like think about the next steps and start looking for jobs. And some people go into fellowship. Personally, I'm just planning to go directly into practice. But yeah, it's a really exciting time. I definitely did not always know that I wanted to be a plastic surgeon. I actually started life thinking I wanted to be a violinist like a million years ago. I've had like a lot of versions. I'm definitely like a non-trad, as they say. But I fell in love with plastics because I, in my general surgery rotation, spent time with 2 female plastic surgeons at the VA in DC. And I was just like, I just don't think I knew what plastics was until I saw a plastics case. And the case was so cool. They were so compelling. I was just like, it really was just like that. Like I was in that one case and I was like, this is it. This is what I want to do. And that was like my 3rd year of med school. Yeah.
That's funny. I had the same experience. Like
really?
I knew I wanted to, I knew I wanted to be in medicine, but it was my 3rd year and I randomly was on plastics for 2 weeks. And I was like, oh my God, this is it.
It's so
I was
cool.
like,
it's like
everything else seemed horrible, right?
Exactly.
I was like, I could be in family practice clinic for like hours staring at the clock. And I think there are amazing doctors that do it. It just wasn't for me.
Yeah, I think that all the time. I'm so glad there are people who want to do all the kinds of medicine that I do not want to do. There's something for everybody.
So can you explain what exactly like is like a chief resident? So it's your last year, but like what does that mean? Like what kind of supervision do you have as a chief resident?
Yeah, so I think it's different in every program. For us, the main thing is that you are like administratively in charge of the service. So we like each of us there's four people in my class, so there's 4 chiefs. So we each take around being in charge of the whole service. So that means that you keep track of all the cases happening at all the sites in the whole system. And then it's your responsibility to make sure that everybody gets coverage, everybody gets the kind of cases that they need to be in. So it's a lot of that kind of logistical work. And the sort of like benefit is that you, because you're making the schedule, get to decide where you want to be. The other piece that we have that not everyone has is we have a chief resident clinic. I'm not sure if you had that in your training.
We did. Yeah.
Yeah. And I think that's really special as well. So we're just kind of getting started on that. But yeah, you're just sort of your top dog, and it has some pluses and minuses. Like I think it is a lot of responsibility. For us, in terms of like there's the patient care responsibilities, our chief resident, like we kind of run services as early as like our 2nd and 3rd year. So that you're pretty much already used to. So really it's the like more administrative side, and like this kind of big picture role.
Yeah, it's a lot of work. I was actually, my program at the time, I was the last single chief resident. And
really? Wow.
It was,
okay,
yeah.
So I have it much better then because I only have to do it for a couple months. You had to do it for the whole year.
but like you said, there are benefits, right? You get to pick your cases. Yeah. And so it's a lot of work, but I think it also is good practice, especially for you going straight into your own practice and running your own place. Like there's a lot of responsibilities within, so it kind of gets you ready for the next step with things. So why did you decide to, or I guess, how did you decide to start your own practice?
So I'm looking for jobs. I want to be in private practice. I guess I
Mm-hmm.
shouldn't say like, I just meant that I'm not planning to do academia or to work at a
Okay,
hospital.
gotcha.
Yeah, so I'm looking for jobs now. I just decided that I'm very curious. I would love to hear about you and like how you decided, like what your first job experience was like. But I just think I thought a lot about going out on my own and decided that I'd really rather be able to partner with somebody and like have a little more support in my first year. Especially I think learning the business side is such a like big part of having your own practice. And I just think I want the experience of working with someone else. And so that's what I'm kind of looking into now, but early
Yeah.
stage.
I think that makes. I mean, I was really in that place. I never was planning. Academia wasn't quite for me. I think there's
Mhm.
still things I do. We call our practice a privademics. So
Oh,
we
okay,
we
cool.
we do a lot. I do cosmetic. I do reconstruction. We have research available at our practices as well. But at the same time, I do what I enjoy doing. I'm
Mhm.
much more of a clinical person, and I enjoy that aspect of it. But I also wanted to learn from people. I knew nothing about business,
Mhm.
and for those of the listeners who are not in medicine, they just do not teach us much about
Nope.
that.
Mhm.
But it is, while it is the practice and the art of medicine, we do have to learn how to, because it's our livelihoods too.
Exactly.
Um, and so
Did
I
you
joined
start
the.
out on your own or you joined a practice?
I am still in my first job.
Oh, okay, good
So
for you. That's awesome.
I went straight from fellowship to this practice, and I've been here for 10 years now.
That's
So
amazing.
I loved it. I went from being an associate, and then now I'm a partner, and I love it, and I got to help build it. But I have
That's
learned
very
so
cool.
much from mentors here. I've been able to learn a lot about business, and I learn more about myself as like a plastic surgeon. And it's nice because when we're in training everybody, we have all these people to bounce ideas off of.
Hmm.
And it's hard if you go out and practice all by yourself. You might be able to call colleagues and call your old attendings, but like here, I literally just walk down the hallway and I'm like, hey, can I run something by you?
Yeah, I basically decided that that's important to me. And I think part of it is like part of the joy, I think, of residency training is being like around all these cool people and being able to like have this sort of community. And surgery, you're always learning in surgery, like you're never done. And so I think it's almost like if I went out totally by myself, I think I would feel like I was like done learning, and I'm not. I want to keep going. So that's
Yeah,
cool. I'm
we
glad that
we're
you've had that experience. I'm glad that it's been good for you because I know it doesn't always work out for people's first job. So that's amazing, inspiring for
yes.
me.
Because people like to quote that statistic, 85% of
Yeah.
people don't stay in their first job. But the funny thing is, I feel like maybe it's just my sample size, but I feel like most of the people I know have stayed where they started. But I
Oh,
know
that's
plenty of
great.
people who've moved around. And I think that that's kind of the cool thing, is that our skills follow us, right? So
Hmm.
sometimes it's a matter of you join a place, you learn skills, and then you move on. And it doesn't always have to be a bad thing leaving some place.
Exactly. What was the biggest surprise for you from like were there things that were different about your first year than what you expected coming out of training?
I didn't really even know what to expect. Like I can
Hmm.
remember, and you will experience this, where
I
like
know,
my
I know.
my first clinic, I was just like, I'm just sitting here. Somebody come through the door, and I mean, my early clinics would be like two patients, and oh my gosh, I'd spend like an hour and a half with them, and I
Yeah.
mean, I did a lot of call and ERs and stuff, and I would sit by their bedsides and chat with them, and it's
Yeah.
not that I still think I'm very much that person. I like to spend time with people, but at that time, you were I was your concierge plastic surgeon because I had so few
Exactly.
patients. But I think it helped me build up, and I figured out what I liked, what I didn't like. And because I did have some senior partners, I was able to, they'd be like, hey, here's a case, go do the surgery. I'm like, okay.
Yeah.
So
That's
I
awesome.
remember my first surgery by myself was a gastroc flap. And,
Oh,
um, and
wow.
I,
That's kind
I
of an intense first case there. Good for
found
you.
found out the found out the first I found out that day, hey, you're gonna do this case. I said, okay.
Okay.
So
It's a
it
classic.
worked.
So.
It worked. Yeah, exactly. It worked out pretty well. But I also
Hmm.
knew that what I can tell you now is I love the business aspect of it.
Hmm.
And I enjoy it. I enjoy growing. I do a lot of mentoring, and we get a lot of students, and I really like that aspect. So I feel like I found a good balance for myself.
That's awesome. That's kind of what I want for myself too. I think like the education side of things has always been super important to me. And I think when I was first looking at career options, I felt like I had to do academia to do that. but you really don't. Like, I think you can do education is such a huge part of even just like the clinical side of what surgeons do. And so I'm hoping to build that into my practice as well. And then I've always like had some kind of side hustle. And so I feel like I want to take that. I have like a little bit of an entrepreneurial like spark in me. And I feel like I'm excited to be able to combine that like more directly with
Yeah.
what I'm doing professionally, you know?
You're speaking my
Yeah.
language.
Yeah.
I have all sorts of side hustles.
Yeah. I love that.
I actually am launching at the end of August. I have a medical jewelry line and clothes, and
cool.
yeah. So
That's awesome.
I'm all for that. I think that all of us in plastics have that in us, as well as the artistic side with things. So
Exactly.
I think that you can definitely manage it all, and I think having that entrepreneurial spirit actually will help you be more successful in your practice too.
Yeah, and I think for me it's just fun to be able to like use different parts of your brain, for your job. So that's really
And
cool.
I couldn't not have you on the show and not talk about your social media because
Yeah,
honestly,
that's one of my like side hustles right now for sure.
that's how I really got to like really know you and appreciate
Yeah.
your sense of humor. But
Thanks.
like I think you do a fabulous job educating, but also making it fun, right? Because I'm not going to name names, but there are accounts where I could fall asleep because it's just like I know that
Yeah.
they're trying, but it's just not fun.
Yeah.
So how did you get into that? Because obviously when I was going through training, nobody had social media like accounts for
Yeah.
that.
For sure. Yeah, I know it's like definitely, and it's still, I think, there's still like an element of a taboo about it, honestly, for trainees. So I was really inspired by my friend Rachel Rubin is a urologist. I knew her like back before I went to med school. I've known her forever. And she went out into private practice, and a big part of how she built her practice initially was through social media. And for her, it was like she wanted to focus on female sexual wellness, sexual health. And like nobody talks about that, especially with like the authority of a urologist. And so I sort of had seen her over many years build her reputation and build her brand through that. And I was just talking to her one day and was sort of like bemoaning, like, I don't know what I'm going to do for my job. I don't know what to do. And she was like, you should stop spending your time on like all this academic stuff that you do, like all the like research papers and stuff. Like that's great, but it's not helping you with your goals at this point. And she was like, just take that time and use that for social media. And so that's why I definitely am not like a camera person. I'm not like a big self promoter. It was very unnatural to me when I started. I've gotten used to it pretty quickly. But yeah, so that's why I started, and it's been so rewarding. I think especially for me because I really care about education. Like I've gotten a lot of really great feedback from students. Because I think part of what I was trying to do is like there's so many things in training that no one actually teaches you. You just kind of have to like figure it out, or more commonly you do something wrong or embarrassing and then people are like, that's a shoe cover, not a hat. And like I think all of those experiences, like we should just talk about them. Like someone needs to like be talking about that and like making a space for that. So that's why I started. And then I don't know, the comedy stuff, I don't know where that came from, honestly. It just started happening one day.
You're like,
It
I'm
has
just
been fun.
natural. It just comes.
It's like something I cannot believe. Like if you went back and told me like even 3 years ago that I was going to do that, I'd be like, no, not going to happen. So
Well, I can tell you, I
whatever.
mean, I'm sure there are like a lot of students who found you like super relatable, but I can also tell you that like amongst like just plastic surgeons, like you're somebody who people are really getting to know and people love your
Yeah.
account. So
Thanks.
I think
That's so good to
I think you
hear.
should be really like proud of it. It's put you in a position now that you go into private practice, you've already kind of built a reputation as someone who likes to educate and things like that. So I would not be surprised if you don't already sometimes get people being like, "Hey, could I come see you?"
Yeah, that's certainly my hope. And I've been really impressed, like, and I hear this from other people who do social media, like as a way to talk to patients, that like it helps you build trust and like build kind of authority. Not that it like needs to be more efficient, but it just like people come in and they already feel like they know you and they already kind of get where you're coming from. And they often like, then they're maybe learning information about surgery from you instead of like random internet nonsense. Like I do feel like part of it is we have to be out there giving good information to fight the bad stuff.
So kind of going back to talking a little bit about
Yeah,
residency, just
for sure.
so tell me a little bit because I've been out of it for a little bit, but like,
Mhm.
what are some things that you feel have really improved that you've seen as during your time as resident?
Sure. So, first, I just want to say, like, I am not like I don't speak for my residency. I'm just like speaking from my own experience. But
Yes.
I genuinely love my residency. I feel so fortunate to be there. I was very deliberate in the residency I chose. Penn has like is known for extremely excellent training, and for me, I was like, that has to be number one. Like, the whole point of this is to have really good skills that I can then take out into the world for surgery, and like I never want to have any doubts about that. So that was my main reason. And then second, I think this it's a program that has a lot of resources and support, and I think that's kind of probably where things have changed the most over time. I do think that is getting better, and I think partly it's like new generations of trainees coming in who are just like maybe less accepting of the like old culture of surgery and sort of the way that people like truly used to just live in the hospital and you should just like work crazy insane hours and like never go home. So I do think things have gotten better on that front, and that it is I believe that it's better for like trainees, for the patients, it's better for the faculty, it's better for everybody. Like, this is a really hard profession, but like you still are a human being. And also, like, if you are a human being who has no time to sleep or eat and no life outside the hospital, like you're not going to be a good surgeon either. Like you just can't, you have to like be able to live a full life. So I've been really happy. And I think too, I'd be curious to know, like, I bet the kind of procedures that we do have probably changed as well, like at least in some way. Penn is like really big on breast reconstruction is a huge focus for us, and we do a lot of like microsurgery as well. And I've really enjoyed that part. I feel like that's sort of almost become like microsurgery obviously has existed forever, but I think it's become more so of something that's like in every hospital in the country. Maybe not every hospital, but it gets more widespread. So that to me has been like a really fun thing to learn, especially because of like the level of expertise that we have in our training program. So we know we do like breast flaps, like multiple ones every week. So yeah, that's probably the main thing. I don't know. I love it. Residency's been awesome. It's been like a really fun time in my life. I love living in Philly. I like bike everywhere. I did all the crazy trauma call that everyone does in training.
Yeah.
There's so much to learn from that. And you really get to know like a city and its people through taking that kind of like trauma call, So,
well,
yeah.
I really like hearing you say that, like, because I do think that there's been a lot of improvements. And for our non-medical people listening, the term resident actually comes because they used to live in the hospital.
Yeah.
Like
crazy.
Literally, they were residents of the hospital. I had my chairman said once that when he went into his ICU month, that they basically were like, if you cross the line at the store, consider yourself fired. So for a month, he lived in an ICU. Like, and so now crazy. That just sounds insane, but that's how it was. Even my dad, when he was in residency, he did 1 year general surgery. He's an ophthalmologist, so it didn't work. But like 1 year general surgery, and like my mom said that they for $15 in New York would rent a room so they could visit him in the hospital.
So
and
crazy.
I was just like, that's insane. So I think balance is good, because if your surgeon is more balanced, they're going to take better care of you. And I think we have a lot more women coming up in surgery
I was just
because
about to
of
say,
that.
Yeah, I found recently there's a Penn is like a very old historic hospital, and they have some like interesting like relics of the old days, and there's a really great like a handbook about appropriate attire for women in the hospital, and it's got like certain kinds of pantyhose you can and can't wear. Like, it's really kind of crazy. Things have changed in a huge way, I think. And for me, I think more women coming into surgery has really helped the culture be better. Because I think, I don't know, we're just like, I don't know. I think women are better communicators. I think we're kind of more understanding of people, like the whole person.
Yeah.
I shouldn't generalize, but that's how I feel.
That's okay. We're probably a little biased, but
exactly.
I think
they were biased before. It's fine.
Right. We're just like bringing it back. Like, I think that we communicate differently, and I think we bring different perspectives.
Exactly. And for plastics, so many of our patients are women. Like, I think we need to have more women in the space,
Agreed. And, it's funny, from the time that I graduated, we were 15%. Now we've gone up to 16%.
So our program has gone. So we actually have 50% female residents now. But when I started, I think it was only 10 or 15. So we've had a pretty rapid increase for us. Yeah.
And I think that's across the board. We're seeing that. So I think that percentage is going to jump up quite a bit in the next few years of the people that are actually board certified. So I think it's a good thing.
Agreed.
It's not that one's better than the other. It's just
for
good.
Sure, yeah.
We all push each other to be better. So
exactly. And I think just having more perspectives in the room is always a good thing. And I think that's a lot of what we bring.
And I agree with you with what you're saying. Like you're a top program, and like being able to do so much free tissue transfer. That was something that was not common. Even when I was in training, we'd like have the occasional free flap. It just wasn't like, and it would be a 24-hour thing, and it was,
Yeah.
no, people be like, oh, you do it, you do it.
Yeah,
And
exactly.
and like now it's like, no, that's just another case. It's just
Yeah, it's just
another
like
case.
a regular day. Yeah, like we just like we'll do like some of our attendings will be out, in time for late lunch, and you're just like, wow, this is, it's amazing how much progress people can make with just doing these cases and getting them like kind of perfected at a high level. So it's really
And
cool.
then we're trying to integrate more, even though plastics traditionally has been I joke, a maximally invasive, right? Like, I mean, we're open.
Yes, which is part of
But I
why we
do,
love it. At least why I
yeah,
loved it. I was like,
exactly.
great.
We like to
I'm not
get
interested
into
in.
it. Yeah. And I didn't want to be in a dark room with the lights out all day,
I know, and
but
cameras and technology. I don't know. I like it is a weirdly old school profession. It's just like,
well, we
steel.
are we are general surgeons, right? We
Yeah,
operate everywhere in the body, but at the same time, I think there's more interesting technology that is getting integrated and more
for sure.
uses within what we're doing. So I think there's just like a lot of new things coming out down the platform.
Yeah.
Is there something what are you most excited about starting into practice? And I know there's probably plenty
So
of things.
I know there's so many things. I mean, I think that part of what I'm excited about is just I feel like when you get to the end of your training, you've been learning everything. Like you're learning like hand surgery, like microsurgery. I'm doing all this pediatric surgery. We're doing like the full range. And so I think I'm excited to learn for myself where I actually want to focus. Like I have an idea of where I want to be, but I think you don't really know till it's like your patient and you're taking them through the entire course. Like which patients do you want to work with, which cases really like are meaningful to you, and are you like especially good at. So that's what I'm looking forward to, I think, about my first year of practice. Overall, I feel like I'm definitely a little bit scared. Like it's a big deal, and I know a lot of people say that that's your hardest year of training is actually that first year in practice, especially if you're doing board collection, which is just like this extra level of intensity that like the entire profession is looking over your shoulder and being like, gonna check all the notes and like check every detail and make sure that you're doing a good job. So I think mostly I'm anxious about the first year, but I am excited
Yeah.
too. It's
It
time,
is. It's like all this time building up, and it's like your stuff. It's just a matter of like,
Yeah.
okay. And the nice thing I will say is, I think this is probably across every program, is I still called my attendings. I still like would
Yes.
email them things and be like, hey, what do you think of this?
Oh
And
yeah.
it's nice. I've even run into residents who I absolutely don't know any of the residents anymore at my program, but like they'll be like, oh, Dr. Wong talks about you still, and it's
Yeah.
like it's just it's still a family that you will always have.
For sure. Yeah, that's part of what I've started doing this year is thinking about like who I'm going to call for different kinds of cases. I've got
Yeah.
all my like phone of friends figured out.
And we could do a whole episode on cosmetic surgeon versus plastic surgeon, but I think
Yes.
one of
Oh
the
my God.
biggest thing is how do you? So you mentioned boards. Do you
Mhm.
can you explain like what that process is, like how you get to being a board certified plastic surgeon?
Yeah. So I think this is so important, and like we cannot do enough education about this. I think like if you are a board certified plastic surgeon, the level of rigor and training that has gone into you being able to offer surgery to patients is just so high. Like there's just like we're up. It's like some of the highest training that you could have in any profession in the entire country. Like it's up there with like astronauts and like it's a big deal. So the board certification process is extra intense for plastics even compared to some other surgical specialties, and that's because it's not only like a test where you have to know your stuff. You literally have to show pictures and all of the records for every single case that you did, or like this big set of cases in your first year. And you will have one of the members of the board, actually like for two of them I think, will sit with you in a room and like grill you about all the decisions you made, and you have to be able to justify them and talk about what you would have done differently and explain all of your reasoning. And it's like people talk about this as being like it's like kind of the final exam of being a plastic surgeon, and it's probably the hardest test that you take too. And a lot of other even medical professions, it's not, there's not even, you may have to like do an oral presentation about things, but it's not specifically your cases. So to me, like whenever I have friends ask about like who are looking for surgeons, I'm like, you got to have a board certified plastic surgeon. There's just no, like, do not go to anyone else for lipo, especially like the number of people out there doing lipo who have like weird
Yes.
training is just crazy.
And it's intense, but you want us to go through intense things because you're putting your life in your hands and your body's in our hands. And
Exactly.
yeah, and like, we take a big written test, which is our knowledge test. You
Yeah.
have to pass that first, and then you go into your board collections. And yeah, at that moment, it's intense because you want to do really well, but it's not just doing really well. It means you're taking the best care of your patients.
Exactly.
And a
Yeah.
big
So I think
focus of the test is safety. I mean, that is a big focus of our
that's
test.
that's honestly like the most important part about it. And yeah, so I like, I just feel like if you're a patient and you're going to a board certified plastic surgeon, you just can have like a really high level of confidence that this is a safe provider who's making good decisions for you. So anyway, I'm scared about board collection, but I know that it's important. And for me, I want to take the best care of my patients. I want to have that certification.
Well, and I'm sure you've heard like a million stories from your attendings. Everyone
Oh
has like this
yes.
story.
There's so
For
many stories from work.
so
It's crazy stories.
to just share with our listeners again a little bit more about like how crazy this is so we get these cases. They pick a certain number of our cases that we then have to create these booklets for, and then we all go to the same hotel in Arizona, and literally to the point that this has been the same hotel for so long that all the staff there knows that it's test time, and you sit outside these rooms and in a chair, and they hand you the book for the ones that come unknown. So it's just you don't know what you're gonna get, and you have like 5 minutes to look at it really quick, and they're not supposed to smile at you. They're supposed to be very serious, and you just go through and you're sweating, but I think the pressure is important because that's how surgery is. We have to be calm
Exactly.
under pressure. And so, and you finish, and when you're done, you feel like throwing up. Some people do.
I bet.
But then that amazing feeling when you're like, I passed and I'm board certified, you're just like, you just know that you really learned what you needed to learn, and you take great care of your
Exactly.
patients.
Yeah, and you proved it. Yeah, totally.
Yeah. So I have no doubt you're going to do kick ass on it.
I hope so. I'm just, it's kind of it's a little crazy in that it's like really more tests, but it is board certificate. It's like it is important, and I really believe in it, and I'll start taking extremely good records right away.
If anyone from the boards is listening, please
Yes.
know that. And I will tell you, it's so to a point that we're not even allowed to advertise that we're about to sit. They really want to make it clear that we're not misleading patients to say that we're something that we're not yet.
Mm-hmm.
And
that's
that
what's
is
so hard,
not,
I
you
think.
can't say that about other boards.
Exactly. I know, but I think it's so hard. I think increasingly patients like are really focused on, and like rightfully so, like a personality match, and like someone that they feel like they are going to connect with and that they can communicate with, and like seeing results online that like they think are what they want. But I do sometimes worry that like we lose that piece of it of like, you really want to find somebody who has this really high level of training. And then among those people, of which there are so many, like picking out of that. But I do sometimes worry that we get drowned out by people who are like, making flashier content, like saying crazier things. And it's not backed up by like the real skill and the real science. So
Absolutely.
anyway, that's why we all have to be on the internet,
Well, I can speak for myself, and I'm sure for many people, we can't wait to see what you do with your career. And, thank you so much for being on the show. If anyone here is really interested in learning from you, how would they find you?
Yeah, so I mainly live on Instagram, so I'm at Dr. Malphrus on Instagram. I also have a website that has like collections of some of my videos on certain topics, so that's lizmalphrusmd.com. And then I just recently started a newsletter that I'm excited about called Cut and Tell. It's on Substack, and that's for now going to be sort of a medical education focus, but I'm looking forward to eventually pivoting it to talk more about like topics that I think patients care about, and doing like evidence-based deep dives on like current issues in aesthetic surgery.
Awesome.
And thank
I'm
you so much
excited.
for
I'll
having
have
me.
to
This
check
has
it
been
out.
so fun. I love that the aesthetic surgery world is like very tiny. And I feel like everybody, like I felt really welcomed into the community. And thank you for being a part of that.
Oh, well, thank you. And thank you guys so much for listening. I hope you learned something new, and check out Dr. Malphrus because she is awesome, and you're really going to enjoy learning from her.